Let us all mute. So only when we talk, we'll unmute and talk.
Ma'am, can you ask the girls? Call the girls, ma'am. I have started the live.
Students, no?
Yes, ma'am.
Pavi, konja first
Yes,
year.
yes, I can see the messages. I can
How many are there online?
see the messages. Can you see, ma'am?
No, I'm not able to.
They are texting right now. Right now. Live 173, ma'am.
Yes, good morning. Harini Bhuvaneshwari.
Okay, we'll
Okay.
start the program, ma'am. Yes.
Yes, they're joining. Maybe once we get inside, live
Okay.
is started.
Live is connected, ma'am. It's going on online. Live.
Okay, so let's mute ourselves.
Okay. Good morning to all. I am happy to invite you all for the International Women's Day celebration. We, as PG Department of Human Rights, find immense pleasure in celebrating this day. Um, we all shall start the program with our college song. Now I would like to call upon our head of the department, Ms. Nitya, to for the welcome address.
Good morning to one and all present here. It's indeed a very happy and proud moment on this International Women's Day that we are here to celebrate this Women's Day on this excellent topic, women and health. Shobha, can you mute yourself? I think it's echoing. Others can- Yes, thank you so much. So on this International Women's Day, we, the Department of Human Rights, ETHIRAJ College for Women, are proudly presenting this webinar on women and health with eminent people to speak on women's health in a very good perspective, that is the human rights perspective. And proudly, like as ETHIRAJians, as a student and faculty of ETHIRAJ, all of us are here really proud to say that this college presenting International Women's Day is a proud moment because Dr. V.L. ETHIRAJ, he has been a pioneer in starting women's college, all women's college, in those days when women were not allowed to go to schools and colleges. So that education was denied for women those days. But he started, he was a lawyer, but he gave all his property and he started this women's college. Now this is one of the best colleges in India, and it has been flourishing. And another proud moment here is this college is again a pioneer in starting a course, which is a full-fledged PG course in human rights, which was one of the first colleges to start such a course in human rights in India. So we are proudly sitting here celebrating this International Women's Day. And there is another proud moment today is because 2 years back on the same day, the Department of Human Rights and Duties Education at ETHIRAJ College, we did a Guinness record performing on stage 24 hours, 28 hours, 32 minutes and 43 seconds of stage play on various human rights issues. Almost 25 students of our college, we gathered and they got trained, they performed. This was to create awareness on various human rights issues. So this happened on 8th and 9th March in 2019, and we are a proud recipient of Guinness record for the same. So on this proud day, as women, we are standing here, we thought like we create more awareness on different issues. Every year the theme will be different for Women's Day from our department. So when the world is celebrating this International Women's Day on various issues, we are coming up with this particular thing, women and health. Why? Because women's health is the most important and most ignored part of health. Because women, they generally they don't their health is ignored by themselves and the society also. So there are many human rights factors attached to it, which we are going to see, which we are going to hear from the experts today, and how women have to take care of their health and what kind of human rights issues are attached to women's health. So all those things we'll be watching from the eminent people who are actually here to help us with all these things. And I'm very happy to welcome Dr. Mala Raj. Dr. Mala Raj is a renowned obstetrician and gynecologist, a specialist in laparoscopic surgery and infertility, who graduated from Kilpack Medical College in the year 1992 and acquired postgraduate diploma from Sri Ramachandra Medical College in 1997. She's also developed a keen interest on endoscopic surgery and did her diploma in endoscopic surgery from University of Kiel, Germany in the year 2004. Her special skills are total laparoscopic hysterectomy and also laparoscopic myomectomy, and to date has done more than 5,000 cases. She's a recipient of Dr. Suli Rudra Sinha Award for the best paper in gynec endoscopy at the All India Obstetric and Gynecological Congress held at Cochin in the year 2006. She's also presented many papers, research papers on various gynecological issues and laparoscopy. And she's also a teaching faculty in Ethicon Institute, where she teaches postgraduates and gynecologists on the nuances of laparoscopy. Dr. Mala Raj actually has been, we are very proud because she's also been a doctor in ETHIRAJ College years back. She's now the founding secretary of IAGE Tamil Nadu chapter, She's a managing committee member of IAGE, executive committee of OGSSI, and she was a past secretary of IMS Chennai chapter from 2010 to 12. And she's an endoscopy trainer, and she's a proud recipient of Best Doctor Award from Tamil Nadu MGR University. And the Times Healthcare Achievers of Tamil Nadu 2018 award was given to her in 2018, and she's also our operating faculty for many conferences. I'm so happy that you're here, ma'am, and I also would like to welcome another guest today, Ms. Kavita D. We are very proud to invite her because she's alumni of the same department, the PG Department of Human Rights. She's one of the finest staff, my student who studied here. Like she's come out with colors. No wonder she was so good when she was doing her course. And she worked with Doctors Without Borders as a women and health campaigner. And she's also a research and communication professional for almost 10 years on health, gender, and participation. I welcome you, Kavita. And I also want to welcome all the staff members, students, and women from various facets of life, like who are gathered here, who are watching here. And thank you so much for coming. I welcome you all with full heart. Thank you.
So, can I start?
Yes, ma'am.
Yeah. So, good morning, everybody. So, it is my great honor and privilege to be a part of this Women's Day celebration of ETHIRAJ College, the Human Rights Department, and happy Women's Day wishes to all the wonderful women out there. In fact, it is a great honor for me to be invited for this seminar, because I feel ETHIRAJ College is really close to me, as it has a great significance in my life, because I started my career way back almost 25 years back as a medical officer in ETHIRAJ College. Even before I could start my practice, and then now here I am running a completely specialized hospital for women care, the Firm Hospitals. So I would attribute all this to the beginning which I had, that is as a medical officer in ETHIRAJ College. So it is my great honor and privilege to be invited for this talk. So I would also like to thank the principal of ETHIRAJ College, Dr. Kodai, and the HOD of Human Rights Department, Dr. Nitya, and Dr. Rekha Sharma for extending this invitation. Of course, I have been hearing quite a lot about your department and its wonderful work, like how they are the first department in entire India for human rights, and also about the phenomenal Guinness Book record, which you all established in way back in 2019, I think the year before the COVID. I think after that, probably we are celebrating only now. Okay, so anyway, from now on, it's going to be really good. As women, we are always positive, and we also ensure that everything good happens for everybody. So now, coming to our topic as to the women's health and her right from a gynecological perspective. So as we all know, the life expectancy is, in fact, of women is more than men. But if you see in Indian scenario, it is almost equal. They, in fact, generally it is understood that women outlive men. But then in Indian statistics, if you say it is only equal, they don't outlive. Why? So that is mainly because of the negligence. It is just that the priorities of an Indian women are something different from that of our Western counterpart, where they attribute everything only to their family and put their health at the backseat. So, however, slowly now women are taking the priorities and setting things right, and they should really know that it is their right to take care of their own health, not just their family. So here we have wonderful women who have achieved phenomenally in their respective fields. So even they have toiled quite a lot. They have crossed many hurdles to reach what you are. And it is really overwhelming to also see ETHIRAJ College also flourishing with all these women, and a completely dedicated women college doing extremely well. I'm sure we have many stars from there as well. So now, for a good health for today's women, what are the things that we need to ensure? So we need to ensure that we take care of our foundation. Mainly, if that is taken care, then everything else will fall in place. So basically, it is all about awareness. So if you are aware about your own body, then you know when exactly what is going wrong and what are the things that you need to really do to make sure they are healthy. So we are in a new global agenda where the health of the women has been now given quite a lot of priorities. And this is mainly because we see that there is more increase in the incidence of non-communicable diseases. Earlier, we had all the communicable diseases like all the infections which were so rampant, but now it is alarming to know that non-communicable diseases are really on the rise. So we need to really make sure that we take care of the reproductive health of our women. So the three main pillars which we need to work on is the knowledge about the health, and also we need to make sure that women also spend time for their own body, that is exercise, and also know the healthy eating habits. So the mental health, the sexual health, and the reproductive health are the three main pillars for our general overall well-being of our women. So today, as a gynecologist, I would like to focus on these four important conditions which are quite common in our women, especially this age group with whom I am addressing, like the polycystic ovarian diseases, the fibroids, the endometriosis, and the cervical cancer. So now coming to the first and most commonest condition which is affecting most of the young girls and also young adult is the polycystic ovarian disease. So how are we to overcome this polycystic ovarian disease is what we need to understand. It is understood that the ovaries are the one which are producing the follicles, that is the egg. Generally, there will be one or two eggs which is getting released during every menstrual cycle. But in case of polycystic ovarian disease, there is no egg coming out, and instead you have lots of cysts, which creates quite a lot of havoc to the women and causes a rise in the male hormones, the androgens, which are mainly responsible for all the side effects for the polycystic ovaries. So India is a capital for diabetes. Now it is also understood that it is also becoming an epidemic for polycystic ovarian syndrome. So it is almost found that 36% of the women in India are suffering from polycystic ovarian disease. But what we don't realize that it is a easily treatable condition if one takes care of their lifestyle. So it is our right to ensure that we take control of our health, but knowing how to exactly manage these diseases. So there is also an epidemiological link when in these conditions, like there is quite a lot of insulin resistant in almost 65 to 80% of the women with PCOS. Why so much of importance we are now giving to this is mainly because this is associated with lots of health issues like diabetes mellitus, hypertension, cancer of the uterus, and also infertility. And the most important thing is obesity. So it also produces quite a lot of other problems like the low sexual drive, and also produces cyst in the ovaries, weight gain, and also diabetes mellitus because of the insulin resistance. And generally it affects the overall physical characteristics of the women by producing quite a lot of acne and hirsutism, and also there will be acanthosis nigrans, where you have hyperpigmentation on the back of the neck. So these can be overcome if the diet and exercise is taken care right from the young age. So here, when we look at all these things again, so why India it is quite rampant is because we also come to understand that the nutrition aspect of the women is not well taken care when she was a child. So the more of a carbohydrate eating habits, the preference of the good diet being given to the male gender in the family, and negligence of a nutritious diet to the female are again found to be the main reason why many of the women seem to be having health issues. So what as a women we need to understand is we also need to take care of our the young generations by giving them not only just a diet but also a nutritious diet by reducing the carbohydrates and also including more of fruits and vegetables, and also trying to avoid the diets which produce more of these hormones like androgens and the testosterone, that is by trying to restrict the non-vegetarian diet. So these are the things which we need to look into, and because carbohydrates are easily available and easily ease of cooking, so everyone tend to fall back to the carbohydrates, and we are basically carbohydrate eaters. So that is the main culprit for these particular conditions which we need to ensure that we cut on this. So basically what we need to understand with this polycystic ovarian disease is that it is a treatable condition but not a completely curable condition. So even young girls, many a times they present with irregular cycles and also all these side effects like the unwanted hair and all the problems of PCOS. But then the moment we stop the treatment, or once they stop the lifestyle modifications, they come back. So it has to be a lifelong phenomena to kind of overcome this particular conditions. So this is generally basically what exactly is happening in the body at the molecular level, where you can see that the male hormones testosterone is at the center. So that is a main culprit. Women has some amount of testosterone generally in her body, but when this level goes really high, that is when she develops all the male features like hirsutism, that is unwanted hair growth, obesity, darkening of the neck. So that can be reduced if you bring down this testosterone level by reducing the weight. So these are the few endocrinological changes generally which happens in a women with PCOS. So based on this, we come to our conclusions. So what we generally see is that many a time the girl come with an ultrasound report saying that she's got polycystic ovaries to our consultation. But just with single ultrasound report, we do not confirm a diagnosis of polycystic ovarian disease. We will put all this into perspective. That is, we look at the general condition of the women and also her biochemical parameters like this, the hormonal profiles, her FSH, LH, and all these hormones to identify whether she is really the polycystic ovarian disease. Because just an ultrasound will not tell us whether she is a polycystic ovarian disease girl or women. So that is where the most important thing which we need to understand. And if the diagnosis is confirmed by any of these features, like that is, there are many features. If she fits the two features fits into that particular woman, then we can put her into a diagnosis of polycystic ovarian disease. Like the complications or the consequences of associated with polycystic ovarian diseases are many. So initially they'll have obesity, and once they get married they will have infertility. And once, even if she gets pregnant, there are problems during pregnancy like abortions, preterm birth, and intrauterine growth retardations, gestational diabetes mellitus. So all these are the major problems with PCOS, and the long-term complications would be mainly diabetes mellitus, cancer of the uterus, and also cardiovascular diseases. So that is the reason why we say it is her right to take care care of our health by following a healthy diet and also a good exercise program. So women with PCOS should ensure that they lose weight by being smart. That is, they have to be the goal oriented when it comes to weight loss by being specific, measurable, achievable, realistic, and timely. There is no point taking all those fad diets, keto diet, this diet, that diet. Nothing is going to work. Where it is or cheating the body, nothing. You cannot cheat the body, you're only cheating yourself. Just go in for a diet which is sustainable and also nutritious. You can't deprive your body of good nutrition. So you have to ensure, main thing is cut on your carbohydrates. Don't follow any other fad diets. Regular eating habits in limited quantities, understanding and analyzing what goes into a system is what is going to pay a long way. So your diet basically should be low in carbohydrates and high in proteins. So that is the basic of everything. And people with weight loss programs, they all work on this in different way. But then these fad diets will have an instant effect. But then the moment you stop it, you gain back all those because they are not sustainable and they will lead to other complications. So we generally advise the women to lose at least 5 to 10% of the existing body weight to achieve some desirable effect. So by following a healthy eating habits, regular physical activity, behavioral strategies like avoiding alcohol and smoking, and constantly having a check on the weight. So 5% of the existing body weight, if it is lost, will get the hormone back to normal. All the hormones will start kicking and you can see the beautiful transformation which takes place in your body. The body will get back its original shape, the hyperpigmentation, all that, the acne, everything will disappear. So basically, generally, when the young girls come to me, what I generally advise is that get into some kind of an activity like sports. So wherein you don't have to waste much time, going out and spending some time just for your exercise. So when you are in a sports activity, obviously you will be into an exercise program. That is the best way which you would also enjoy, and also it has quite a lot of health benefits. So the women come with irregular menses. And when do you consider a women's cycle is irregular? So is when they have a cycle of more than 45 days immediately in the post-menopausal, post-menarche, that is after they attain puberty. And in the reproductive age group, when the periods are beyond 35 days or if it is less than 21 days, and if she gets periods only 3 times in a year, then you can also consider that it is as irregular. But a girl, if she does not attain her periods or menarche by 15 years or more than 3 years after post-telarche, meaning after the development of breast, then it has to be looked into and we need to decide what to do about it. So once a diagnosis of polycystic ovarian disease is made, the first line of management, as I mentioned, is only lifestyle modification, wherein the diet and exercise plays a very major role. If that is not taken care, then you have no other choice but to subject yourself to pills, like wherein we put them on OCPs, which would reduce this male hormones, androgens, and the hormones will again start kicking and you will start getting your regular cycles. So of course, hirsutism, which is unwanted hair, has also been found to be the major problem, and this can also be corrected by giving isotretinoin. But only thing is, the girls who are in the marriageable age, we advise them not to get pregnant at least for 3 months after stopping the medication isotretinoin. So again, that needs to be kept in mind for girls who are on isotretinoin for hirsutism and acne. The main concern of PCOS is infertility. This is mainly because in PCOS they do not produce eggs, and as a result they are finding it very difficult to get pregnant. So we as fertility specialists, we take care of that by helping them with producing egg production medications like called ovulation induction agents, and make sure that they ovulate, produce eggs, and help them to get pregnant. Many times they also do not respond to any of these medications like clomiphene citrate or letrozole or metformins. In such a cases, unless and until they lose their weight, nothing will work, and you can also ask them to go in for the next step, which would be the laparoscopic ovarian drilling. But this laparoscopic ovarian drilling should not be done for women who are unmarried. So young girls, there's no other surgical procedures should be done for PCOS, which should be really kept in mind. Never subject a girl to any surgery before she is married for PCOS. So PCOS drilling can be done only when the woman is married and she is finding it difficult to get pregnant, not for any other problems like irregular periods or heavy bleeding. So counseling plays a very major role in tackling PCOS issues, and it is the right of every girl or a woman to understand her condition by asking her doctor to explain and what exactly is her issues. She will be able to understand so that she will be able to manage this condition in a long-term basis, because as I said, it is a treatable but not a completely curable condition. So she has to live with this condition. So she need to understand the physiology and the pharmacological aspect of the treatment. So these are the various treatments which I have described, and we can also advise laparoscopic ovarian drilling for these women if they are married and if they are not able to get pregnant. So this, me being a laparoscopic specialist, would like to share some of the surgical videos in each condition. So just to make you all understand how exactly the problem is and how things are working when you clear those issues. So this is a case of PCOS. The white pearly one is the ovary which you are seeing. So this is how the PCOS ovary will look. The ovaries which are generally producing eggs are not producing eggs. So we are drilling these ovaries by making small punctures on the ovaries. So once you make these small punctures, the male hormones which are found to be elevated in these ovaries comes down. So once the male hormones comes down by this drilling, then we kind of treat them with medications and get them pregnant. So this is to be done only in women who are married and who are not able to get pregnant, not for young girls. Now, so having understood about polycystic ovarian disease or the syndrome, now let's move on to the next condition, which is quite common in our girls and women. It is the fibroid. So this fibroid is again found to be a major threat, because we are seeing more and more girls and women coming with fibroids. And in fact, I do quite a lot of this laparoscopic myomectomy, meaning removal of fibroids. And in fact, I really wonder how people wait so long without giving any attention to this particular condition. In fact, the entire last week, I was doing at least 2 fibroid surgeries every day. So that is the rate at which the fibroid is really going up. And it is not the simple fibroids. They are the huge fibroids, which almost weigh 2 kgs, 2.5 kgs. And it takes a time for me to do those procedures laparoscopically to remove this 2 to 2.5 kg fibroids. So the importance, what I want to highlight here is that early identifications. If you have a fibroid, try to get it evaluated by the right specialist to understand whether it has to be removed. And if it has to be removed, try to remove it early and do not allow it to grow to as big as a 5 months pregnant uterus. That is how I've been operating these days. all the women who've been coming to me with fibroids are really huge. So they come right up to the umbilicus like a 5-month pregnancy. So because fibroids are generally a benign tumors, meaning they are quite an innocent tumors and they do not become cancerous. So that is the reason people seem to be taking the fibroids for granted, thinking that they do not cause any problems. But one should understand that the fibroids, there is no medical treatment available. There was one pill which was used for fibroids, but then it did produce quite a lot of side effects and has been taken out from the market. So surgery is the mainstay for the treatment of fibroid, but your treating gynecologist will be able to guide you as to whether surgery has to be really done, and if done, which is the best modality. Of course, it is going to be a laparoscopy or hysteroscopy in the current scenario. So what is the reason for these fibroids is what people keep wondering, and the reason is that we cannot tell you. There are many reasons running over pages, but still categorically we cannot tell you. So that is the reason for this woman to develop fibroid in her condition. So the etiology is though not fully understood. We have a wide set of etiologies. It is mainly because of the mutations which are happening in the muscles of the uterus. That is, the fibroids arise from the myometrium, meaning the muscle of the uterus, which would undergo proliferations or mutations and form a huge mass. So it is also understood that the role of epigenetic regulations, that is, when the baby was inside the mother's womb, certain changes which occurred to the baby have also been found to be one of the triggering factors for the development of fibroids in that particular child in the future. So early life adverse environmental exposure has been found to increase the risk of fibroid development. So this is a current concept which is now coming up regarding the development of fibroids. So again, the exposure of the fetus to diethylstilbestrol and all these hormones, which are mainly responsible for the growth of the fibroids because of the sensitive windows of development that the baby is under during this phase. So management, of course, there's no role for medical management. Surgery is the key stone for fibroids management. Either it could be a laparoscopy or a hysteroscopy. Sometimes if the woman has completed the family uterine artery embolization and HIFU. So just to have an idea like how exactly these fibroids look and how we manage the fibroid, this is my surgical video of a laparoscopic myomectomy. So here you can see that the white, this is the one which is the fibroid and this is the uterus. So I am removing this fibroids laparoscopically by injecting a solution onto the uterus to make it totally bloodless. So you can see that the entire fibroids will be coming out of the uterus by this gentle dissection, and once the entire fibroids has been enucleated from the bed, that is from the, so this is the uterus and this is the cavity of the uterus and this is the fibroid. So as I am enucleating the fibroid, then you can see that the entire uterus now has been freed from the fibroid, and once the fibroids have been removed, I am getting the uterus back to its shape by suturing it again. This is also done by laparoscopy, and I do not do any kind of open surgery for these fibroids because the benefit that the women would derive by doing a laparoscopic surgery is phenomenal. So here I am closing the entire uterus after removing the fibroid and getting the uterus back to its normal shape. So this is a skilled surgery which needs quite a lot of expertise to perform this particular procedure, and you can see at the end of the procedure you can get a clean uterus with how it was before prior to the surgery, but minus the fibroid. So you can have a clean uterus without the fibroid, and it is ready to do its job, either it is for fertility or whether it is for its normal gynecological functions. So the finally you can see that this fibroid has been put inside the bag, and it has been morcellated, meaning it has been cut inside the bag. This is again a special technique which I perform so that there is no dispersion of the tissues into the surrounding structures, and to make the procedure an extra safe one. So this is again another kind of surgery for the fibroid, which is now being performed by me, wherein here if you see the entire fibroid is inside the cavity, and I remove the fibroid and put them inside a bag and remove them. So again, this fibroid has been removed. I'm forwarding a little bit. So once the fibroid is removed, then I am suturing the uterus back to its normal shape. So this is a very interesting case where she had almost 18 fibroids, and 15 of them were inside the endometrial cavity, meaning inside the cavity of the uterus. And this particular lady had gone for a procedure in Canada for removal, but then they had deferred the procedure because they were not able to do it hysteroscopically. So she came to me and I had to do it laparoscopically and removed almost 18 fibroids from this particular uterus. So once this fibroid, all the 18 fibroids were removed one after the other, then they were all put in a bag and then removed. So this is what we need to understand in case of fibroid. If the woman has completed her family, then it depends like whether she wants to remove her uterus or she wants to remove only the fibroid if the woman is above 40 years or 45 years. But in younger age group, that is less than 40 years, even if she has completed the family, it is better not to remove the uterus, better to remove only the fibroids, because she can still have the reproductive functions intact at least until she attained menopause. But above 40 or 45 years, then with the proper discussion with the gynecologist and looking at all other factors, then we can take a call whether we have to remove only the fibroid or we have to remove the uterus. But what one needs to understand, that even if a woman is going to go through for a hysterectomy, like total laparoscopic hysterectomy, so try not to remove the ovaries. Okay, so that is very, very important. So because the ovaries are the one which are producing the hormones, and they are going to give her quite a lot of support. That is, they will have the cardiac support, the heart problems will not be there if the ovaries are intact, the bone support will be there. So even if you're going to remove the uterus, if the ovaries are intact, you will get a good benefit from the hormones produced by the ovaries even after the surgery. So that you need to keep it in mind. So now coming to the next condition, which is quite rampant, which is endometriosis. So almost 30% of the women of the reproductive age group seem to be suffering from this condition, and almost 50% of the infertility, endometriosis, have been found to be the cause. So if a woman has both these conditions, that is endometriosis and infertility, it is a very frustrating conditions. So to get a good successful outcome from this particular disease, you have to have a good surgery and also the fertility mind, meaning the gynecologist who is able to tackle both would be the right person for tackling this particular condition. But whether endometriosis really causes infertility, or we are just doing only much ado about nothing, or it has been exaggerated, so still we don't know, because many women with endometriosis also conceive, and also not that all women with infertility are having endometriosis. So if we need to understand the particular women, and then see what would be the best method for managing the endometriosis. So endometriosis, when it occurs in young adults, that is even before the woman is married, we need to understand that conservative management, that is management with medications, would be the right approach, unless the she has a very huge chocolate cyst which is causing so much of pain, which would warrant a surgery. Otherwise, we need to understand that we can manage these conservatively until she gets married. And after marriage, if she's not able to get pregnant because of the endometriosis, then we need to remove them. So it has the monthly fecundity. This is what it is. Fecundity meaning the fertility is lowered in a woman with endometriosis. So the problems again associated with endometriosis are mainly the pain, the infertility, the pregnancy, complications like miscarriage, placental problems, bleeding issues, and the long-term effects of endometriosis like cancer. So this is mainly because the anatomy is compromised, the oocyte, that is the quality of the egg is compromised, and the inside lining of the uterus do not respond very well to the embryo, that is endometrial receptivity is affected. So when a woman is thinking of marriage and children, there is no role for medical management. In such a cases, we have to clear the endometriosis surgically and ensure that we start the fertility treatment. But in case of an unmarried young adult, then conservative management would be the best option. So surgery does help, and these are the few surgical videos of the endometriosis. Here you can see this is how the endometriosis, the brown thing are all the endometriosis. See what exactly is endometriosis is that the inside lining of the uterus, it comes out and gets accumulated in the ovaries. So that is why, can you see, it is all brown in color. So that is why we call it as chocolate cyst. So once you open this, you'll have chocolate fluid only material coming out. So these are ferocious looking ovaries which are causing so much of pain. So once you do the surgery, then they become pain free and they are able to lead a proper life. This is again another case of endometriosis or the chocolate cyst. Here you can see how both the ovaries are affected with chocolate cyst. So here I am removing the chocolate cyst from the ovaries and preserving the ovaries. So can you see the fluid which came out? So that was a chocolate material. So that is why it is called as a chocolate cyst. This is mainly because of the reflex menstruation. The menstrual fluid getting accumulated within the ovaries, forming a bag, and in due course of time, because of the chemical changes which are occurring in the fluid, develops the chocolate color. So again, one needs to understand that the first surgery should be the best surgery for women with chocolate cyst or endometriosis. Here you can see this is a recurrent endometriosis where she was operated and she has recurred and she's come back again to me for a surgery. So better to do the first surgery as a proper surgery, because endometriosis surgeries are quite challenging and skillful. So you need to identify the right person to do this surgery for you. Now, again, the pregnancy rate with endometriosis have been found to be reduced, but with surgical management, it improves. So these are the latest concept in endometriosis, wherein surgery is the gold standard in the treatment, that is laparoscopic surgery, and medical treatment only if the woman is unmarried. Now coming to the last condition, which is quite rampant. Again, it is found that cervical cancer is really on the rise, because many women now seem to be developing cervical cancer, and this is found to be the second most commonest cancer apart from the breast cancer. See how exactly cervical cancer develops is what we need to understand. So cervical cancer, basically how cancer develops is that normally the cells have a lifespan. So once the lifespan of the cell is over, then the cells have to undergo apoptosis, meaning the cells have to die. But what happens is, because of some stimulus or because of some mutation which is happening in the cells do not die. They will keep on multiplying and dividing, producing more and more cells and forming a lump. So that is what is called the cancer. So this cervical cancer is very common in our Indian population and is the second most common cancer for death in India apart from the breast cancer, which is the leading cause of death. So why now this is important? So we need to be aware as to how the cervical cancer develops and how we can prevent it. So that is very important, because this particular cancer is very easily identifiable, unlike your other cancers like colon cancers and other cancers. So this cancer, you can identify it at a early stage itself by a very simple test, and also it is easily treatable if identified in the early stages. So that is why we have to be aware of this cervical cancer, and it is every woman's right to know what exactly is the cervical cancer. And you have to make an effort, not just a right, you have to make an effort to understand what it is and how it develops. So now let me tell you how the cervical cancer develops. So the cervical cancer, so this, if you see, this is the entire uterus, and this is the body of the uterus, and this is the mouth of the uterus. So can you see a very clean mouth of the uterus, and this is a vagina? Then slowly, can you see the redness here? It is getting infected. So this infection, if it is not treated, it develops into this white lesion. This also, again, this also at this stage also you can usually cure it. And if this is also not identified, then it goes to the cancer stage. So that is why early identification and treatment plays a very, very major role in the treatment of cervical cancer. So what does early identification mean? Early identification means we have to screen all women who are sexually active, meaning women who are married, and suppose if the women, there are premarital relationship, then those women also should get a pap smear. Why? Because this cervical cancer develops only because of a small virus called the human papilloma virus. It is not genetic. So unlike your other cancer like the breast cancer, which all have a genetic component, what one needs to understand is that the cervical cancer, there is not much of genetic predisposition. It is mainly because of an infection by a small little virus called the human papilloma virus. So once we identify the virus and treat the lesions, then you can protect yourselves from cervical cancer. So it is almost found that 60,000 women keep dying of cervical cancer annually between the age group of 15 to 44 years. So as I mentioned, this is a virus. It reminds us of the coronavirus, right? So this human papilloma virus is the main culprit for the development of the cervical cancer. And we have various strains of this human papilloma virus. You have the HPV 16, 18, 6, and 11. So these are the strains, like how you have many strains in the coronavirus. The same way, the human papilloma virus also has various strains. Of this, the major culprit is only this, that is the HPV 16 and 18. So which is mainly responsible for the cancer. But HPV 6 and 11 strains are responsible for the anogenital cancer. So how you can prevent is by eliminating this virus totally from the body. So now we have a vaccine for corona. So we were all dying to have a vaccine for coronavirus. Now vaccine is available, everyone is hesitating. Why? So that is the ignorance. So same way in human papilloma virus, there is a vaccine available which not many people are aware. So we can easily bring down the incidence of cervical cancer if everyone gets vaccinated for this cervical cancer at an early stage. So early stage meaning you have to get vaccinated even before the human papilloma virus makes its entry inside your body, meaning you have to take it even before your sexual activity, that is before you get married or before you get into sexual activities. So the right age for getting vaccinated for this HPV is at adolescent age. The moment the girl attains menarche, it is better to give her the vaccine so that she will develop antibodies to this particular virus when she has a sexual contact, and she will be able to get rid of this virus from her system and protect herself from damaging her uterus, that is the cervix. So because, as I mentioned, human papilloma virus is mainly sexually transmitted by genital skin to skin contact, and a non-sexually transmitted also from the mother to child. See, many a times we miss, if the woman has missed the vaccine during her adolescent phase, and if she comes to us for delivery, at the time of delivery, after delivering the baby, when she is in the hospital, we give her the vaccine, because that is an excellent time, because she has the opportunity now again to take care of herself, because she's going to be available at home with her child, so she can also protect her child and also protect herself anyway, because she will be coming to the hospital to vaccinate her child. She can also get herself vaccinated and protect herself. So that is the reason we ensure that a woman during lactation, while she is in the hospital, also is protected by giving those vaccine. So the right is to understand. So we have to educate, we have to screen, and we have to vaccinate. So what is the dose of this human papilloma virus vaccine? So we have 2 doses and 3 doses. So you need only 2 doses if you get yourself vaccinated early. Meaning, if you get vaccinated at adolescent age, you have a single dose, and 2 months later you have 1 more dose. That's it. We are done with it, and you are protected from the human papilloma virus. So any time when the human papilloma virus enters into the body, your antibody will kill the virus and will protect you. But if you miss that period, and if it is between 15 to 45 years, then you have to go for 3 doses, where you take the first dose, and the second dose is after 2 months, and the third dose would be after 4 months. So again, so what one need to understand is that even if you are vaccinated, then you need to do the routine pap smear screening. Pap smear screening, because sometimes we never know this virus, how it enters, because if you vaccinated early, then you have a 100% protection. But if you get vaccinated after sexual contact, then the virus may be remaining dormant in your body, meaning it can lay quiet for about 10 to 20 years. Then after 10 or 20 years, it will show up its true color by causing damages to the cells. So that is a reason to undergo the early detection. We do a pap smear. And again, pap smear is a very simple test, wherein you just take a swab from the mouth of the uterus by scraping the mouth of the uterus either with a brush or a small little air spatula, send it to the pathologist, and the pathologist will tell us whether there are any abnormal cells or the cancer cells or the virus in the sample. So that will again give us a early detection. So early detection, the management becomes very, very simple. So only when we miss that period, then you have to go for all extensive treatment for the cervical cancer. So having understood all these conditions, like which are quite common in the reproductive age group, I am not touching into the menopause and post-menopausal problems, because of the group of audience whom we have young audience. So we will stop, and apart from that, if you have any other issues, then you are free to ask me, and I am here there to answer and guide you. So ultimately, women should keep this in mind. That is, you should have a balanced approach. All of us are working. Now we see more and more women coming forward to do all that they like. And it is very, very encouraging to see women come up really very, very nicely in their respective field. And we are really proud of it. But we need to have a balanced approach in whatever we do, take care of your health, take care of your family, and take care of your career. So that is the secret mantra for any successful women, and wish all of you a very, very happy Women's Day. So with this, I would come to the end of this presentation. And if there are any questions, I am happy to take them. Thank you so much for giving me this, for extending this invitation. Yeah.
Thank you so much, ma'am. Thank you so much for the information pertaining to reproductive and reproductive rights, reproduction and reproductive rights. Ma'am, there are a few questions put forth by the viewers and the students. First one is, what are the treatments available for endometriosis?
Yeah. So as I stated, yeah, my voice is echoing.
No, ma'am, it's audible.
Oh, okay. Yeah. So endometriosis, you have conservative management, that is medicine. Yeah. So you have conservative management, which are medical management. So medical management meaning you have the hormones. See, basically any disease, we should understand them at the molecular level. So what is happening in endometriosis is these are having high estrogens. Okay, so they are hyperestrogenic conditions. So that is why women who have more estrogen in the body are the ones who develop these conditions. So unfortunately, all these conditions like endometriosis, the fibroids, the polycystic ovarian disease, whatever I mentioned earlier, they are hyperestrogenic conditions. They have quite a lot of estrogen. So in endometriosis, if the estrogens are very high, then they will be very happy to grow. So you have tissues growing outside the uterus because of the effect of the estrogens. So what we have to do is now get the estrogen down. So you give the anti-progesterones. Those are the ones which will reduce the estrogen level and reduce the lesion size and give her relief from pain. So this kind of treatment can be done in young girls and young adults, okay, so who are not planning to get pregnant. Because why I'm telling you this is, if a woman is planning for a pregnancy, these drugs will not allow her to get pregnant at all. So that is why if the woman is not planning a pregnancy and if she is married, then she can be on these medications. But when fertility is an issue, that is, if she's married and she wants to have a baby, then you have to go for the laparoscopic surgery, wherein you have to remove these lesions laparoscopically, get back the entire system under control. That is, there will be quite a lot of additions. All the tissues inside the body, that is the pelvis, the uterus, tubes, ovaries, everything will be totally jammed. So you have to release all those things, additions, and put the tissues back to its normal configuration so that she will have relief from pain, and she will also develop eggs, and she will also be able to have a baby. Many a times what happens is, sometimes this endometriosis will go within the muscles of the uterus also. So that is called adenomyosis. So when it goes within the muscles of the uterus, like how she is having regular menstruation, she will also be having menstruation inside the muscles. And she will also be having menstruation inside the pelvis, that is outside the uterus. So that is why they have so much of pain and they have heavy bleeding. So these women will also have marital difficulty because they are so painful that they will not be able to stay with their husband. Their sexual relationship will be very, very painful. So they will avoid normal sexual relationship also. So all those things can be corrected if we do a proper laparoscopic surgery. But what one needs to understand is the laparoscopic surgery has to be done by the expert in that field, because the first surgery should be the best surgery in this case of endometriosis, because otherwise the chance of recurrence are very, very high.
Thank you, ma'am. We have another question. How to check the cervical cancer, ma'am, whether we are affected with it?
Yeah. See, basically, yeah, cervical cancer can be detected by a simple test called pap smear. See, that is what I was mentioning. See, this pap smear is nothing. See, the cervical cancer is only from the cervix. Cervix is the mouth of the uterus. So, when the virus attacks the cells in the mouth of the uterus, they will undergo certain changes. The normal looking cells will have abnormal looking patterns. So we will scrape the cells from the mouth of the cervix, and that is the mouth of the uterus, and we'll put it in a small slide and give it to our pathologist. The pathologist will read those slides under the microscope, and they will tell us whether there are any abnormal looking cells in this particular slide. If there are any abnormal looking cells, they will report it to us. So not necessary, like, the cancer has to be a full blown cancer. There are certain conditions even before the women develops a full blown cancer, that is called the pre-invasive diseases, that is pre-malignant conditions. So this pap smear will help us to identify even before the women develops a cancer, that is a pre-malignant stage. So if you catch them at the pre-malignant stage, so that is the right time to treat them and they can escape from cancer. So that is the importance of the pap smear. So it is not we are doing pap smear to pick cancer. If you're going to have a cancer, you can easily detect it. The woman by itself, she will come with lots of complaints. She will have foul smelling discharge, she'll have pain, she'll have many other symptoms. But we are not trying to do that. We are trying to identify women who would develop cancer so that we can prevent it. So the pre-malignant condition is what we are trying to look. That is the preventive aspect of this particular condition. So once you do it, then the treatment becomes very simple. Can you unmute, please? Dr. Shobha, can you please unmute?
Yeah. Thank you, ma'am. We have another question that, somebody has asked how hair fall is associated with PCOS, ma'am.
Yeah. See, basically, as I said, again, PCOS, you should understand that how I said, like endometriosis, estrogen is very high. In PCOS, the male hormone, that is the testosterone, the androgen, okay, so that is a male hormone which is very high. So normally, some amount of androgen and testosterone will be present in any women. But when they lose their balance, okay, when that gets elevated, you will have all the male features. You will have, because this androgens affect the hair follicles. Okay, so you will have, it will prevent the further development of the growth of the hair and it will drop. So that is why they have the frontal baldness and everything. And they grow in the places where they should not go, like, facial hairs and all those, hirsutism develops. So because of the excess androgens, there will be a fall in the hair. So not only we have to supplement with nutritious food and other things, we should also correct this hormone, for which we will give medications which would reduce the androgen level in the body. So along with the other medications, so there are vitamins for hair fall, like, the biotin, which is all found to be very good. So along with the biotins, we also give the contraceptive pills, which would reduce the androgens and allow the women to develop fresh hair growth. Okay, so meanwhile, the basic is what is they have to modify the lifestyle. So weight loss, once you lose weight, obviously all these hormones are all generated in the fat. So once you lose the fat, then the androgens also come down. Then it is very easy for them to tackle their condition. Otherwise, how much of medications you give, nothing will work.
Okay, thank you, ma'am. One more question. How much does the surgery cost, ma'am? For example, removal of uterus or for endometriosis, like that? Like, people would like to know that as well. For women.
Okay, so that is depending upon the condition, right? So, see, if it is based on the extension of the disease, that is why I said anything in the early stages is very easy. And it is also economical because if you're going to have a small uterus for say for if you're planning for a hysterectomy, so the time spent by the doctor and the stay in the hospital, the equipments used for the particular surgeries, all that will add value to the surgery. So that is why anything in the early stages in the small size would be very cost effective. So you can even get a total laparoscopic hysterectomy, even say for 80,000 also. But at the same time, we can also go to 1.3, 1.5, or even 2. If you're going to have a huge 20 week size uterus, say like 2.5 kg of uterus, you have to remove, and through a small keyhole. Imagine the amount of time we need to spend. We spend at least 3 hours, 4 hours to remove that entire uterus out through that small little 5 mm hole. So that means so much of work, so much of the instrumentations, everything plays into the role. The team is involved, so that is why the cost goes up. So that is why if you are going to go to the doctor in the small early stages, then it is also not only you're going to benefit and get rid of the disease early, but also economically to be really open, you will also benefit. So don't wait for anything too long.
Okay, ma'am. One more question, ma'am. What would be the food diet would you like to suggest for the young women, ma'am?
Yeah, so as I mentioned, no fat diet. Okay, so everyone knows fruits and vegetables are the best. So that is going to sustain lifelong for years and decades. That no one can change over that. But the thing is, like you should also understand that our body needs all the micronutrients. Okay, everything in small amount is needed. We need fat, we need protein, we need carbs, all the minerals, everything is needed. So how can you deprive one completely? Like if you see the keto diet and all, they say you cut the carbohydrates, let fat do the job. Okay, so that is not the thing. You cannot cut it. Some body needs some amount of fat also. So energy building is by the fat. So understand that and take it at a moderate amount. Whatever you consume in moderation. So the crux is we also need carbohydrates. So have carbohydrates in moderation. You cannot forgo carbs completely. In moderation, you take your carbs, and you need proteins plenty, because our body protein is very important. Because collagen, as I'm not sure whether you all know, but collagen is the main thing for the strength of the tissues. Okay, so it is generally said that collagen is as strong as steel, because if a woman's tissue, everything has to work well, then she has to have adequate amount of collagen, so which is derived from the proteins. Okay, so women's strength in the uterus is also based on this collagen, meaning from the protein, because the tissues which are supporting the uterus, that is the uterus is in the center, and you have the ligaments which are strong holding the uterus. The uterus is going through the pregnancy, it is going through so much of changes because of the hormones all through her life. So that strength will be got only by the collagen. So if the collagen is reduced, automatically the uterus also becomes weak and it drops. So to derive collagen, you should have good amount of proteins. So that is when you get prolapse, no? When the collagen is not there in the tissues, the support in the uterus is not there, and the uterus drops out. The uterus comes out of the normal place, that is, it comes out of the vagina itself. So that is called the prolapse uterus. So all that you can avoid if you take a good protein diet, and not only that, apart from that, other things also, like proper exercise of the pelvic floor, all that has to be done. So now coming back to the diet, so your diet should be low carbs diet, good amount of proteins, and very little amount of fat. So apart from all the other micronutrients, so cereals, nuts, all those things are very, very vital for our body. See, all these non-vegetarian diet, Okay, they have quite a lot of these male hormones like androgens and all that. So I mean, maybe in moderation, you cannot completely forgo them, means you can have them in moderation. So that is I mean, people replace non-vegetarians, like, the chicken for all the proteins. So that cannot be done. So you cannot completely ignore your proteins from other sources and replace it only with your non-vegetarians diet. So you should have a balanced amount of everything. So that is the crux.
Thank you, ma'am. I have one personal question. That is, can't we treat fibroids or endometriosis through medication alone?
Yeah, see, as I said, see, fibroids are, first you understand, if we understand the disease, we'll be able to understand the treatment. Fibroids, how do they develop? They develop from the muscle of the uterus. So the uterus has three layers. You have the inside lining, which is the endometrium. That is what is shedding every month, and you're getting a regular menstrual cycle. The inside lining is the myometrium, which is the muscle, and the outside layer, which is the parametrium. Okay, so now this fibroid develops from the muscle, which is the myometrium. It develops actually from a single smooth muscle cell. That single smooth muscle cell undergoes multiplication, mutations, to form a huge mass like this called the fibroid. So how are the medicines going to work on this huge mass? So there was a molecule like uliprostol which came in. Okay, so initially it made a very big noise. People started using that uliprostol tablet, and it was found that the fibroid was shrinking. But once the effect of the uliprostol weans off, then the fibroid started growing back again to the same size. So these were supposed to be used for women who are not fit for surgery, or who are waiting for surgery because of certain reasons, because of her health issues, because her hemoglobin is less and we want to build up the hemoglobin, or because her medical condition is not allowing her to get operated. So in such a situations, we can offer these medical line of management. But unfortunately, what has happened is, in spite of all these things, uliprostol went out of market because it started causing liver damage. So now that is out of the market. So apart from that, if you look for medical management, then we have certain things like GnRH analogs. Like we have Leupride depot injections, that is GnRH analog injections, which we can give monthly once. Okay, so again, these injections, you have to give them for 3 months or 6 months, monthly once, only in indications where they are not ready for surgery, where they are not fit for surgery, so that you have time to prepare them for surgery. Because again, when you take them off these injections, the fibroids grow back to the normal size. So again, there is no point. And apart from this, these injections, they also cause bone loss. There will be erosion of the bones and they will lose their bones. So we have to always supplement them with calcium. So those are the things which we have to keep it in mind. So as such, if you see, medical management are not very effective for fibroid. As a stopgap, you can use this. And there is also called intrauterine system device. That is like Copati. You have intrauterine system which you can put it inside the uterus, which will release a hormones called levonorgestrel, and that will to some extent help the women from the bleeding, from the pain, and from trying to reduce the size of the fibroids. But again, they are not 100% curative. So that is why when it comes to medical management of fibroid, surgery is the gold standard treatment. But when to do surgery is what we need to understand. Not all the fibroids have to be removed. If you're going to have a very small 2 centimeters of fibroid, inside the uterus, that is in the myometrium, based on the location, again, it matters. If the fibroid, even a small little fibroid, inside the endometrium. That is, if it is going to be a submucosal type of fibroid, wherein the entire fibroid is lying inside the cavity of the uterus, that is going to cause quite a lot of problem. Either it will produce heavy bleeding, or it will not allow her to get pregnant. So in such a situation, those small little submucosal fibroids, we have to only remove them by hysteroscopically. But if you have a small little fibroid, say around 2 centimeters, 3 centimeters, or sometimes even a 4 centimeters also, if it is not giving her any problems, then we can wait and watch. But if the fibroids are big enough, say above 4 centimeters, then it is better to remove them, because definitely these fibroids are not going to remain the same size. They are only going to keep increasing with every year, and they can reach the size as big as, like 2.5 kg or 3 kg, whatever. I have in fact removed a 5 kg fibroid also. So that is the size they can reach up to. So why wait until they do so much of damage to the uterus and then remove it when it is there? And if you have a clear indication for surgery, get it done.
Thank you, ma'am. One more question on human rights perspective, I would like to ask. How about the ratio of people coming to you for son preference? Do you have such cases? Or
yeah. See, it is there. I turn them off. Okay. So many are there, in fact, asking, what would be the gender. In fact, the irony is, like infertility patients, I get really shocked. Infertility, they would have been literally struggling to get a baby. They would have gone even through an IVF with me, and they would have got a girl child. Okay. Then after many years, then again they want to have a second child. They know what trauma they went through. They will say, second child I want, but it has to be a boy. I give it back to them. I turn them off. See, they know what difficulty they went through to just have a baby. So when they come for the first child, they say, okay, doctor, if I have one child is enough. I don't want anything else in this world. Okay. When that is achieved, when they want a second child, why at all go for a preference like that? So I said, we will not do it, and it is not being done. And then I gave them a peace of mind and sent them. So, and again, so many a times I have also seen, even in the current scenario, with 2 girls, lovely girls, and they come for a third boy child. I said, it is not at all possible. So, I mean, it is just that it is no from me, from my end. But then I seriously don't know what's happening outside. But then now the current rules are very, very strict. So no one does any sex, gender selection, reduction. Nothing is being done. So it is just that people have a wrong notion that if they go to doctors, they can identify and do anything that they want. Because the laws are very, very strict and stringent, it is not being done.
okay, ma'am. Thank you. Thank you, ma'am. Our HOD madam has some question. I'll just put forward.
Thank you, ma'am. I have 2 observations. One is like both are in human rights perspective. One is like when we know, like at this point of time, many women, they undergo stress and depression and even familial domestic abuse and all those things. So how does these things contribute to sexual and reproductive health? So this is one thing. And another one is the priority for health on women is very less. They give priority to the family members and like their welfare and other things. So mostly women, they don't come at the first stage of the issue. Like they come much later. So what is the percentage of women who are coming there like at the first stage initially when they identify? So whether they give preference to their own health or health rights. So these are the 2 things I wanted to know, like whether the stress is contributing to all these issues and this.
Yeah. Okay. So that is excellent. Yeah. Stress is the major culprit for everything. Okay. So even for your hormones to work normally, so you should have a balance. Okay. So the hormones are generally generated from the brain. Okay. And then it comes to the ovary through the an axis called the hypothalamo-pituitary ovarian axis. So if that axis has to work well, then the body also has to be calm. So for the hormones to be released in a proper manner. During stress, what happens is this axis get disturbed, and she will not get the right hormones at the right time. So that is the reason you can see that many of the women who are stressed are also gaining weight, because of the imbalance in this estrogen and progesterone hormones, which is causing a havoc, and she keeps gaining weight. So obviously, so it is all interconnected. Okay, so once the stress occurs and you have hormonal imbalance, they tend to gain weight, and because of this, then again they will not be producing eggs properly, they will not be ovulating. So obviously, when they are not ovulating, they are not going to get pregnant. So because of that, infertility. So not just the stress, this infertility now is going to again add another stress. So the stress is going to multiply. So basically, I think not physically alone, emotionally also one needs to be very, very strong, because the current scenario is that the world is very demanding. Okay, so whether it is a man or a woman, so the demand for everyone is really on the rise. How we are going to train our body and mind to keep calm and keep doing our job is what is the crux. So I think that kind of a habit has to be inculcated right from the small age, right from the school level. These kids have to be trained and tutored as to how to manage the stress. So they have to be exposed to various activities, so that will help them to face the world much better when they are exposed to the outside world after marriage. Because that it is a different issue altogether once they're getting married, because of the added responsibility. I see many women are not able to handle it. So there are some who are strong and you're able to face and manage somehow, and then get into the balance of work and life. But some fumble and they are not able to manage. So ultimately, I think that cannot be developed overnight. It has to be inculcated right from a small age as to how to be strong, how to handle family, because the dynamics in each and every family is very different. So what works well in your life may not work well in my life, because your family may have a different environment and expectation. My family will have a different environment and expectations. So everything can't fit into one shoe. So that is what I'm trying to tell. We need to understand our family. We need to understand our nature of job. We need to understand the circumstances and see what best we can derive. So I generally say that better don't give up on anything. So many women say, okay, now I want to start my family, I'm going to give my job and take care of the family. But then what happens is, it is not that it is good if she's going to get pregnant and do, but then ultimately they get overstressed because of the fact that she is not used to sitting at home, and she is not getting bored, and there's nothing much to look forward to. Is what? Because the work was keeping her. So I say you manage, juggle a little bit, try to balance, take some days off, like that. So those are the little small modifications which only that particular women in that scene will be able to understand how well she can help herself, how well she can adjust to the family surroundings, and how well she can still go on with her life. So those things, I think it has to come as by nature. So that can come only if she has been groomed in the right manner right from the small age. So that is why you have to expose the child to every activity when they are a small girl. Expose them to sports, expose them to all kind of extracurricular activities, so they get a little bit of confidence. Just even when they are into all these sports activities and all them, they are able to balance many things in their life because of the hormones, the adrenaline, everything. They are able to manage many things much easily is what I feel. So I think we have to do all these things to our girl child, so they will be a better human. As an adult women, they will be able to manage many things. Can you please unmute?
Thank you, ma'am.
Yeah.
Thank you, ma'am. There are many questions, actually, many more. We have told them that we will reply you once we ask and after the sessions, because every question cannot be put forth, and it's like it's already 12:30 now. We are taking you much of your time. Thank you so much, ma'am, for enlightening us on the various health issues that are reproductive rights. 1 second. Reproductive. It's my child, ma'am. Reproductive rights. Thank you so much, ma'am. And it was very useful, actually. Like you have thrown light on how women can pick up sports regularly, sports activity regularly, to keep them healthy and to avoid all these health issues pertaining to reproductive system. And the food diet, or everything should be there. That was much useful. And you also told us about the effectiveness of having laparoscopy instead of taking medication, because medications may cause damage to our organs, the organs. So it was quite and much helpful, useful information. Hope all the students who had joined have got all this information. Thank you so much, ma'am. Now I'll leave it to our head of the department. Ma'am, it's up to you.
Thank you, Doctor. It was a very wonderful session, and it was very informative too. And I will now want to introduce our sponsor for the program, Aero Squad. It's a center for academia, which is providing coaching for all the competitive exams and on many subjects, and also for the government exams, including UPSC, TNPSC, UGC NET, SLET, and banking exams, etc. And they are also providing, facilitating conduction of research programs, and also promote and accelerate and aid public awareness program through various medias. So they are sponsoring this event on this International Women's Day. Thank you, Ara Squad. Over to Shobha.
Thank you, ma'am. Now I shall call upon Kavita Devadas for a discussion session. Kavita, I'll just add.
So I would like to thank the entire Department of Human Rights and ETHIRAJ College for this opportunity. Thank you so very much.
Thank you, Doctor.
Thank you so much. Actually, we are also honored.
We are really honored. Thank you.
Kavita, the session is open for you. Please do share your experience on health and women and health as a researcher.
Thank you, Shobha ma'am. Is my voice audible? I can hear myself echoing a little bit.
It's audible.
Okay.
Here. It's audible.
Okay. Okay, great. Before I dive into the session, I want to just thank you, thank the department for having me, be part of this wonderful session on Women's Day. As an alumni, it's an absolute privilege to be, be invited to share my experiences for the session. So thanks again for that. So Dr. Mala made this fantastic presentation, and I just have a very brief thing to add on to it, which is basically from the human rights perspective. And I wanted to start that by just reflecting on why is this even a topic? Why is this even a conversation today? Why are we specifically talking about women's health and human rights? And take everyone back to exactly a year ago when we had, I think it was around March 15th, that the government imposed a lockdown due to the COVID-19 pandemic. And they had essential services marked out for this period. When you're under lockdown, some services would be considered essential. The government did not think of abortion and contraceptives as essential. It took them one exact month, around April 14th or 15th, when they came up and they realized that this is an essential services. What will women and their partners do around the time of COVID? Because it's not like people are not having sex. It's not that people are not in the middle of the pregnancies, or there might not be instances of sexual abuse, rape. All of these instances are happening even during COVID, especially when people are locked up in their homes or in different situations. And what about the mental health impact of not being able to access abortion and abortion services or contraceptives? It took them exactly 1 month to realize this, after a lot of hue and cry from women's activists and health activists. So which is why, and then the health ministry obviously made these services essential, even though there were supply chain blockages, restrictions on travel. So this is exactly why we're having this discussion on why women's health is important, but also to look at women's health from a human rights perspective. So what is the human rights perspective on women's health? I want to take a little bit step back and say, what is good health? Good health, often when we think about health, is that we think about physical health, but there are also, especially linked to women's health, aspects like, do they have access to good food? Do they have access to clean water? Do they have access to sanitation? Privacy, do they have access to sexual and reproductive health information? And the ability to make informed choices about their health. So there are various aspects which are not just physical, but also social determinants of health, which make it important. That's why we need a human rights perspective, So having said that, so yes, physical, emotional, mental, and the power and agency to be able to use that information and make these choices. That's one. And the second aspect, also, this is not a new topic. Women and health has been spoken of. The right to health has been spoken of in many instruments, in laws. The international instruments like the ODHR, the ICPCR, the WHO Constitution talks about it, the right to health, and focuses specifically on women's health, understanding that women are marginalized in society. And the Indian Constitution, while it doesn't specifically talk about the right to health, the right to life, Article 21 refers to that, as do the directive principles. So legally, yes, it's enshrined, the right to health, it's protected, it's been discussed, but we don't talk about so much about the other aspects to it. So when we say we need a human rights perspective, we're also thinking about what are the political, social, cultural factors which impact women's health, which impact women's ability to choose these health services and use this information. That's one aspect of it. And again, I want to take another step back, is that when we talk about human rights perspective, often traditional human rights perspective, all of these legal instruments, they look at political participation and public institutions as the determinants, so which is why we need to open the layers and to look at what are the other factors which play an important part. So that's, I think, an important aspect to note. So I want to, because we've had like such an enriching presentation and discussion on women's health and the health problems they go through, I want to talk a little bit about just an example through my own field experience and anecdotes that you hear. So where do these factors come into play? So say the example, in a rural part of India, there is a 20-year-old young woman who goes to a healthcare provider. She is pregnant for the third time. This is child number 3 that she's expecting. She has an infection, she has nausea. When she meets the health provider, she says, I have this infection, I have this health problem where there's some bleeding, there's some infection. I want you to take a look at it. And while they are discussing, they're doing the exams, she tells the person, my husband beats me. He forces me to have sex. I don't enjoy it. And there's the 2 children I've had are female. I have not produced a male heir. So I want this child to be a male child. Otherwise, he will beat me again. So this abuse will continue. What are the various issues at play? So we need to take a look at that. Is it just the biological concern? Is it just the infection? She does have nausea. She does have infection. She's obviously suffering domestic abuse at the husband. But it's also the thinking that operates that if I produce a male heir after 2 female, the abuse will stop. I will not have to put up with this. So this is the thinking. This is how she's internalized the problem, and this is what the solution she's looking at. So again, when we say we want a human rights perspective, women's health, she needs access to contraception. She needs to be able to space the children, the birth of the children. But most importantly, I think she should be able to have her own say in this process about, does she need a male heir? Does she need to be pregnant for the 3rd time? Does she need, to make these choices in consultation with the partner? And what is her process, her consent? So there are various factors at play, and often we don't think of it because we have been trained to think of women as reproductive machines, to not look at their identities beyond a daughter, a wife, a daughter-in-law, a mother. But there are so many things that make a woman, and also she's a human being outside of being a woman, So that's why it is so important to have that women's health issues linked to the human rights perspective. So that's one aspect. And again, when we're looking at women's health and human rights, we also need to, this is something that I think has been part of my work experience, is looking at intersectionalities, the way I, an able-bodied person, upper caste person, experience violation or health problems is not the same as somebody who may be having a disability, maybe queer, if she is, or if she's of a rural, from a rural part, if she has poverty, she's from an impoverished background. So there are, and again, my identity, my ability to access information choices is important, but is it at the same level as some Adivasi woman in a village in Jharkhand? So when we talk about discourse around our laws or interventions, policies, sensitizing healthcare providers, health education for communities, we need to also think that one size does not fit everyone. When you have policies, when you have interventions, they need to look at the diversity of women and our experiences, and also to bring that richness of conversation to allow women to also participate in this conversation. I think a lot of time healthcare providers, these health ministries, they don't consult women, and we end up with these gender insensitive policies and interventions. That's I think very important. Again, because we talked about mental health experiences, I have worked in a few mental health institutions, and I looked at the gender perspective over there. So again, I want to illustrate the importance of why do we constantly talk about her using a human rights perspective, and how does it affect women specifically. So one of the mental hospitals I worked at, over there, our research indicated that women consistently over years received fewer visitors compared to the men. And a lot of times women were abandoned in these institutions because they were not considered, because of their mental illness, which is, a health problem. They were not considered eligible to be mothers, to go back to their roles as wives. And the family constantly thought, if she is mentally ill, what will society think about us? Who will marry her? And if she's not going to be married, how will this impact the marriage potential, dowry potential of her other siblings? So it's not just the woman and her health condition. They're also thinking about these 20 other factors, which is not related to her mental health, mental illness. And there were also instances where there was a higher rate of women experiencing sexual abuse, sexual violations within these institutions, either at the hands of the healthcare providers or from other inmates. That was one. There was a documented case where forced hysterectomies, which is where you remove the uterus, right? And so you cannot bear children after that, were performed on these women with mental illness, because the understanding that you are a woman, you are mentally ill, so why would you want to have children? So it's not a consensual procedure. And second, you are, as a state public health institution, you are making these choices which infantilizes women, which treats women as children, as even if they have a mental illness, you don't consult their family, you don't consider their well-being. And these are procedures which have other ramifications. It's not just their ability to produce children. They have other health ramifications. So this has also been documented. In another institution, women were not provided sanitary pads. They were just asked to use cloth. So again, it goes back to women's health. Yes, physical health is important, but we have to constantly broaden that conversation. Are we listening to the women? Are we thinking about how this health issue interlinks with other rights? If a woman is not able to access nutritious food, adequate food, vitamins, healthcare checkups, then it's meaningless to say, yes, there is healthcare providers. Yes, you have money to go to a private or a public health practitioners. The services are good. She must have the power and agency to be able to make those choices, to be able to access those information. So that, again, to go back to the anecdote I shared about COVID, a lot of women in India, I hope I got this statistic right, not statistic, but I think abortion is legal under certain circumstances, which is, and it's allowed between 20 to 24 weeks. But a lot of women don't know that. We ignore the realities that young women are sexually active, premarital sex happens, rape happens, incest happens. Yet we focus only on the cultural aspect, that we don't allow women the agency to, to discuss these issues, to have her sex health education. So these are some of the experiences I have had in my field, and why I feel like we cannot just talk about women's health as a vacuum. It doesn't exist on its own. It's always going to be linked to various other rights. But it is important. It is important to work on that and bring that human rights perspective, whether we are working in an NGO, whether we are working with healthcare providers, whether we are working in rural communities or big cities. So those were some of my reflections that I had to add.
Thank you, Kavita. I just wanted to share my observation. I found that many women, they feel that my husband has a right to beat me, or the violence I'm facing is just because I'm born as a woman. So, and my health is secondary over my family. So many things like this. And there is this notion, like most of the women, they don't understand that what they are facing is violence. Like even if it is a subtle violence, they might not even know. Like they are deprived of sleep in many houses. They have to sleep after the family members sleep, especially the husbands and in-laws sleep, and they have to wake up before everybody wakes up, and they have to eat after everybody eat in the family. So even now it is going on. Even in some families, I have found in a research that once they get married, the maid servants are being stopped just because she enters into the family. So such things are also there. So they don't understand that their health is a priority, and their health gets deteriorated because of all the environmental issues which they are facing. So what is your opinion or your experience on this?
My experience is exactly what you were saying. women don't even, and I think personally within my family, within my friends' families, in general, in society, even in pop culture, like when we see advertising or movies, I think women's health and women's roles are portrayed in a certain way. It's exactly what you said. Women don't prioritize their health. And the problem becomes, where do you start? Where we say education is important, we say policy making is important, but where is the first step is where I think a lot of people disagree. And exactly like what you said, there was a project on malnutrition, and so many of the women, it was not that there was not enough food in the house, but a lot of the food was kept for the male members. So first the father, grandfather, then the son, then the mother would eat. Then, so not only is it the timing, but it's also the quantity. And of course, maybe another thing is, again, the class bias and our own experiences. We may not experience it as ourselves, right? Like as women in cities who are, or maybe there are people who are experiencing this also in living in cities and being upper class. But these ideas are so prevalent, the norms are so prevalent, it's so hard to discourage. When you tell the woman, no, you have to also eat on time, your health is important, she says, no, 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 how can I eat? I'm a woman, I have to be patient, it's not my role. So my experiences have also been very similar to what you're saying. Yeah.
If there are any questions to her, you can post in the messages. Maybe Kavita will be able to give her experience over the questions. Okay, maybe it's clear. Shobha, you have anything to?
No, ma'am. Thank you, Kavita, for sharing your experience with women and health, especially on this Women Day. We are just looking that health is very important after everything. So hopefully every ladies who had attended this webinar will get advantage of the lectures and the useful informations which they got through it.
There's a question.
Thank you so much.
There is a question in the comment box. What should we do to make women think they are equal to men? Kavita, can you answer this question or?
What do we do to make women think they're equal to men? I mean, the larger problem is obviously patriarchy and social norms. I think more education, asking questions, and of course, I'm a firm believer these things have to start very young. We have to start inculcating these ideas at a very young age. And I also think it is not just the burden of young women or women to educate society. We also need to teach men to respect women's rights. We also need to teach men. And when you're talking about women's rights, women's health, remember, we live in a society, we have social relationships, we live with men, we coexist with men. So I think when you target education, policies, interventions, let's not only make it the responsibility and onus on the women. We also have to look at young boys, men in the family, older men, younger men. We have to include them in the conversation, so that when women speak up, women talk about their experiences, men listen. Men, whether they are policy makers or a bureaucrat or a politician or a husband or a boyfriend, they listen to the women and they are able to respect those choices. Because again, women don't live on a single planet by themselves. It's a relationship, right? So I think education, empowering women to speak up, to ask questions, to not be afraid. And third is to not make it the responsibility of only women. We have to work together with men and women. That's, I think, the way forward.
Like you said, like the answer is in the question.
Yeah, I think the financial independence.
The other way around, we have to make men think that they.
Yeah. Can I add, the financial independence of a woman also makes a difference. So I think every woman, they should also make it a point that they are financially independent. So their value goes up the moment they think that they are, financially independent. It gives them quite a lot of confidence, and also to take part in all the conversations and whatever the discussions and the decision making in the family. So I think that also plays a very, very important role. And apart from that, apart from all these physical and abuse and other things, there's something called the emotional abuse also. I feel like which is more rampant. Like there are many families where physically they may not be hurting her, but emotionally they put the women into quite a lot of trauma. So for that also, I think how they are brought up, to be mentally strong makes quite a lot of difference. So they should be able to really handle the situation very well only if they are mentally strong. So that aspect also has to be inculcated in the women.
Yes, doctor. Actually, that's what we used to tell our students, that education and career is very important. They have to be financially independent in order to think that men. So that we always inculcate most of students. We used to talk to them. There's another question: why the laws are not strict on violence against women? Maybe Dr. Pavitra can answer this question.
Yes, ma'am.
Shobha, you mute yourself.
Yeah, the laws are made not very stricter, just because it has to be a little bit flexible, and some leniency is allowed. Stricter laws is definitely not good for a democracy, but it should be more firm, not stricter, but more firm, so that there is no recidivism. Okay, when there is a domestic violence, if the laws are much more firmer, that is, the implementation should be much more effective. Okay, if the implementation is effective, then there won't be more of a recidivism in domestic violence or whatever crimes against women are happening. So in that case, having more and more laws and making the laws more stricter and making and giving more punishments to the wrongdoers is not going to work out. It is only the correction which is going to work out as far as any kinds of violence against women or crimes against women are concerned. So correction, the perpetrators, they have to feel that what they are doing is wrong, and they should come out of it. So our correctional system should be more towards that end rather than punishing the individual or making the laws more stricter. Okay, so maybe that's why our laws are like this, with a little bit leniency and not towards more of a punishment. Okay, we do have countries where laws are more stricter, so to say, severe punishments are given to people who violate um, laws for women and things like that. But even there, statistics show that there is no recidivism, or things have been happening. Okay, there are increase in violence against women, even in the domestic sphere. Okay, so it doesn't prove that stricter laws are the remedy for such things. It is only proper corrections and firmer laws which makes a difference. I hope I have answered your question.
Yes, Dr. Pavitra. I also feel that culturally, we have to be sensitized, like in the society, more than the laws. Like women should be treated equally and respected equally. So only then the violence will come to an end. Because many laws are there, but we are still practicing many laws, including dowry. We have laws, but still practice is there. So laws are strict, but nobody reports. So that is the point. So I think sensitization and more of change in the culture or in society is more required. Okay, I think we are.
Yes, ma'am. I do think the same way. One more thing that we need to change the attitude, the behavior towards men. That is, the submissiveness has to be changed to a certain extent. We ladies go on accepting things silently. That should be given concentration on a little bit, so that the attitudinal or behavioral change can. To a certain extent will improve the women
At
status.
this juncture, I thought I would like to thank the men nowadays. Like they're coming up, they are talking about women's rights. They talk about feminism. So hats off to those men who are actually standing by our side to empower women and talk about equal rights. So thanks to them. So, I think we are coming to the fag end of the session. Shobha, can you just call upon?
Okay. Yes, ma'am. I have a we have a small presentation for just 1 minute about the sponsors we have. It will take this. I'll just share the screen. So they are Arrow Squad, which is meant for Center for Academia. They are aimed they aim at providing coaching for all the competitive exams, facilitate the conduct, accelerate and aid public awareness programs. They deal with the competitive exams such as UGC NET, UPSC, IBPS, the banking personal selection exams, SSC, RRB, TNPC, and all other exams, government exams, and they provide with all qualified faculty members, well experienced professors, and lectures by eminent professors as well. And they have provided the contact details here. So if you have if you would like to join, you can call them for the classes. This is the contact details, and right now they take online classes.
Shobha, is it over? Ms. Shobha, is it complete the presentation?
Yes, ma'am. Yes, ma'am. Over. Now it's over to Dr. Pavitra, MB Pavitra, for vote of thanks.
Thank you, Shubha. Good afternoon and happy International Women's Day again to all. It's a great honor to have this opportunity to thank all of you on behalf of the Department of Human Rights and Duties Education. This day, we had the privilege of having Dr. Raj as our chief guest. Thank you, ma'am, for being there with us today with all your resourceful explanations, videos, and meaningful suggestions and for answering all the questions of our audience. And our audiences will be definitely benefited by the information you have imparted to us today. We immensely thank you for making it to the International Women's Day function online. And it was indeed a great privilege to listen to the special address of Ms. D. Kavita. She is an alumni of our department, of whom we teachers are very, very proud of. Kavita, we thank you for articulating the voice of our department, which reminds us a voice of reason, humanity, civilized thinking, and you beautifully silver lined it with your experience in the relevant field. Our gratitude are due to Arrow Squad Center for Academia for coming forward so willingly to sponsor our webinar. We place on record our gratitude to ETHIRAJ College Trust Board, Dr. Eskoda, ma'am, our principal, Usha Rani, ma'am, Vice Principal Aided Stream, and Usha Priya, ma'am, Vice Principal Self-Supporting Stream. They have always given us their unstinted support to all the programs we organize. And I have to mention about the efforts of system admin Mrs. Kavita. Her support for organizing this webinar was exemplary. Thank you, Kavita ma'am, for being our support system. I thank our head of the department, Ms. Nitya, and Assistant Professor Shobha Sharma for coordinating and making this webinar happen. We thank Shirley Grace Nirmala, whom we consider as an individual think tank, and her resourceful ideas are always there for us in any academic endeavor. I thank Meghala, the first MA student of our department, for her enthusiastic assistance in designing the invite for this webinar. And it is indeed a pleasure to have such a wonderful audience from different fields. They have turned up not only from Chennai but also from other parts of the country. I'm sure this webinar will benefit each and every one of you. The postgraduate departments of postgraduate students of our department were also with us, making themselves available whenever we call. I called them 11 o'clock, 12 o'clock in the midnight yesterday, asking them to do this and do that, and they coordinated and make this event possible. Thank you, girls, for all the help you gave us. Again, thanks to all the organizers, speakers, participants of the workshop. Thank you so much. And now the national anthem will be played to end the session.
Ma'am, before I could wind up, ma'am, we would like to also thank our system admin Kavita. Yesterday full day I was with her. Great thanks to our system admin, Miss Kavita.
Yeah, can I play the national anthem?
जनगण मन अधिनायक जय हे भारत भाग्य विधाता पंजाब हिमाचल यमुना गंगा उज्जल जलधि तरंगा तव शुभ नामे जागे तव शुभ आशीष मांगे गाहे तव जय गाथा जन गण मंगल दायक जय हे भारत भाग्य विधाता जय हे जय हे जय हे जय 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 जन गण मन अधिनायक
Thank you so much, ma'am, and thank you all. With this, we come to the end of the session. Thank you so much.
Thank you so much. Thank you so much, everyone.
Thank you.
Thank you, Dr. Malaraj. Thank you, Kavita, and for the wonderful audience. Thank you so much for participating. Thank you.
Happy Women's Day.
Happy Women's Day. Happy National Women's Day to all. Thank you, ma'am.
Yes, ma'am.
Yes, Shubha. Thank you.
Okay. Okay, ma'am.